The robots are about the size of an upside-down 10-gallon bucket. Think of a small R2-D2 unit without wheels. Take off the first lid, and there's a simple computer that can schedule samples throughout the day. The half-inch rubber tube on the side of the device runs into the manhole cover, then directly into a sewer line. Take the second lid off and you see a plastic water bottle where the samples are collected. Postdoctoral researcher Smriti Karthikeyan says there are more than 120 of these robots quietly doing the dirty work in the battle against the pandemic on the UCSD campus.
So it keeps taking these samples over a 24-hour period. So when we pick up the sample the next day, it's a representative of the entire day and not just the moment we're grabbing samples.
Samples are brought to the Biological Services building every day.
I am scanning in the bottles after they've been collected by their QR codes, and those automatically come up on our Google Docs.
Lab technician Caitlin Tribblehorn identifies where the samples come from and then prepares the contents for processing. The sewage water in the bottle is concentrated and prepared for analysis. The system has evolved since it was first deployed last summer, and that's important because pretty soon the campus will be crowded. This testing system is expected to be an important tool in the battle against COVID.
It will be, because every day we're making developments on increasing the number of samples, and we are focusing on that every time we discuss ways to make it better.
Sample collection and testing is only the beginning. Results are put into the UC San Diego COVID-19 daily dashboard. The pandemic's impact is tracked there, including how many people on campus have had infections in the past week. And the sewage testing data is shared there as well.
We have an interactive map with all these buildings, which get updated every day. So if you see a blue, it means that building did not have a wastewater positive signal. If it was red, it means that we did see a positive signal from wastewater that day.
The building occupants are typically notified and encouraged to get tested if a sample tests positive for the virus. And because the data is uploaded once a day, the history for more than 350 buildings can be tracked.
So we can see if it was one infected individual in the building infecting the other people, or they all picked up their infection somewhere else and brought it back to campus.
Rob Knight is the director of the Center for Microbiome Innovation at UCSD. He helped set up the system because he and other researchers realized early on that COVID-19 was being transmitted before people showed outward symptoms.
We think of COVID as infecting our lungs and our airways, but it also infects our gut. And for many people, it infects the gut before it infects the respiratory system. So you can be pooping COVID into the sewage long before you show up at a hospital with respiratory symptoms.
Early testing last summer led to the discovery of infections on campus in people that didn't realize they had the disease. Because of the way the UCSD sewer system works, positive samples can be linked to specific buildings. An early warning provided by the sewage test can be invaluable when the full campus population returns for the first time in more than a year.
Even if you're vaccinated, you can still get infected and you can still infect other people. And so keeping our astonishing success record with cases low on campus is going to require continuing to be extremely vigilant.
A recent study by Karthikeyan and Knight found that 85% of COVID-19 cases on campus were detected early by the sewage testing system. That makes it a crucial tool to control outbreaks once the students return to campus next month. Erik Anderson, KPBS News.